We are born with a sense of wonder. And I really think we have to encourage our children to grow that sense of wonder, to ask questions of absolutely everything. It's the best route to the most comprehensive education. And when I was growing up, I was inspired by science. For me, science gave some of the best answers. You could ask questions, you could ask them again, you could challenge them, you could come up with different answers, and it made me think. And this chap here, Carl Sagan, really inspired me with a book of his called Pale Blue Dot. And it was then that I realized that the cosmos we inhabit goes back 13.7 billion years. It was then that I realized that the very atoms that made my body were forged in the heart of stars that exploded and died, literally, so that I could be born. What a sacrifice. I was hell-bent on becoming an astrophysicist. I studied maths, I studied physics, and I was pretty good at it. But then circumstances contrived against me. And there was an act of extreme cruelty when people hijacked an Egypt airplane and forced it to land on the tarmac in Malta, and they started shooting the passengers in the head while they made their demands. And this was before Facebook, before the internet was widely available. And this was the first time I realized how cruel we could really be to each other. And as luck would have it, my father was the first neurosurgeon on the Maltese Islands. I hated his job. He was never at home. He was a slave to everyone else. He wasn't there when I needed him. He had to go and do an emergency operation there, an elective clinic here. But it was that time that I realized what my father did for a living. Because in that time of cruelty, he went in and operated on 3 of those patients who'd been shot in the head. And 2 of them survived. And one of them wrote a book about her experiences. And this moved me at a time of such cruelty that we could use our knowledge, we could use our skills to show compassion to each other. And although I still adore physics and the cold reaches of space, I changed my mind. And I decided that I was going to become a neurosurgeon. The human brain, what an incredible thing. It's got more connections than stars in our galaxy. Think of that. Your brain is who you are. It generates our movements, it generates your thoughts, it generates your beliefs and your feelings. It gives us identity. It's so important that nature has encased it in a fortress of bone. No other organ is surrounded like bone like this. It wants to protect it. And illness and disease, when it affects this most important of organs, it's cruel indeed, because it attacks our very identity. Traditional neurosurgery is what most of you think of. You've got a tumor on the outside of the brain, inside the brain, in the middle of the brain, and we need to take it out. Or we've got a blood clot that's pressing on the brain, and we have to operate in an emergency to save a life. There's a structural problem. You can see what's wrong with the brain. This example here, this is the nerve going to the face, and there's a blood vessel pressing against that nerve. And every time that person eats, he gets unimaginable pain in the face. And we can do a little operation through a hole the size of a pound coin just behind the ear, and we can move that blood vessel away from the nerve. You can see the dent in the nerve there. And neurosurgery can be very rewarding. I got that note to say thank you. But it's also very humbling, because for every patient that I can help, there are countless others that I just can't. My academic interest is in this subspecialty, functional neurosurgery, where the brain looks normal, but it doesn't work normally. This young lady has Parkinson's disease. Started early in her life. The medication doesn't work well enough. You can see she's got tremor. She's got stiffness. And when she makes the movements, they're very slow. And it's affecting her quality of life such that she can't enjoy her children, she can't enjoy her husband. And here we're putting a wire, a very thin wire, very precisely in the center of the brain, a place called the subthalamic nucleus. And we pass a tiny electrical impulse through that, and the rigidity disappears, the stiffness disappears, the tremor goes away, and the movements are much more fluid. I do this 3 or 4 times a week in London, and I never get tired of it. It's so rewarding. After we put that wire in, we connect it up with wires underneath the skin to a battery, and you've got a little pacemaker there. Just like a pacemaker that goes to the heart, but it's a pacemaker that modulates the brain's activity. And we call this deep brain stimulation. Now, this sort of operation has been done for many decades, actually. But our group in London has done a lot of work to make this operation more accessible to people, to make it safer, and to make it more accurate. We have to pass our probes through this delicate organ, weaving past this network of blood vessels without causing damage to any of them, without causing a bleed, without causing a stroke. And we use very high technology, MRI machines, and very sophisticated surgical tools to perform our surgery. It's very challenging, it's very rewarding. But there are side effects. This is a lady who has Parkinson's disease. When we turn the stimulation up a little bit too much, she starts laughing. What she's reading is not remotely funny. Not at all. She can't stop laughing.
I started to cry, and then I laughed at myself.
And then you laughed at the same time.
Crying.
When we turn the stimulation down a little bit, that all disappears. We bring her back 2 weeks later, turn the stimulation up again. She starts laughing again. How powerful is this? And it's not just our group that has seen this. There's a wonderful paper from Germany where they operated on a patient with Parkinson's disease who was also an artist. And before surgery, this was his topic. He used to paint landscapes, beautiful, detailed. And 3 months after surgery, he came back, and the doctor said, "How are you getting on?" He said, "It's wonderful, I can move again. And you know, I'm so creative now, and my art's taken on a different form." And this is what he showed them. And his wife was enjoying it too. So it changed not only their emotions, but their behavior. For the better, for the worse. Who's to judge, if not that individual? So what we saw here made us think back to whether we can use surgery not only to help movement disorders like Parkinson's disease and dystonia and tremor, but whether we can use these operations to help patients with very, very severe mental health disorders that don't respond to any other sort of treatment. And it turns out that we can. And we've performed a number of trials in the UK, in London. And for example, we've published a paper on Tourette's syndrome, where you get involuntary tics and your level of anxiety goes up until you make a tic, makes your anxiety go down again, and then you make another tic. And these tics can be so severe that you can bruise your spinal cord with the severity of tics. And we've shown that by placing an electrode in a particular part of the brain, we can suppress those tics and improve quality of life. We just finished a trial of deep brain stimulation for OCD, obsessive compulsive disorder. There's a condition where, it's not like we're a little bit too in detail with things. These are patients who won't go to the bathroom, because if they go to the bathroom, it's an 8-hour ritual for them to clean themselves afterwards. People who have been in institutions for years and years and years. And one patient, one young lady who went in through this trial, is now in a relationship, touring Europe. She even has a horse. She couldn't shake my hand before the surgery. These are not 100%, they don't work in 100% of patients, but this is giving hope to patients where there was no hope before. So how does surgery work? Can we learn something about the human brain by trying to understand what's going on? And when we look at the circuits, how the neurons are connected within the brain, we can see that those circuits that control our movements and our emotions and our thoughts are actually very similar. How is it that you can have such similar circuits making such different functions? And it turns out that what's happening is that the brain is always trying to continually is continually trying to predict what's going to happen next. And if there's malfunction in the brain might think or predict that your hand is here, but it's actually here, and therefore it tries to correct the position, and you end up with tremor. Or if you need to get up from a chair and you predict that you need a certain amount of muscle tone in your muscles to stand up, you predict that you need more, and you get dystonia and abnormal movements. Or if you have obsessive compulsive disorder, you predict that your hands are dirty, and no matter how much you wash your hands, your brain is still predicting that your hands are dirty. And by looking at the activity of deep centers within the brain, by recording from those wires that we place in the brain, we can see the abnormal activity. We can actually detect the levels of abnormal activity and see how the symptoms correlate with that level of activity. And this has turned us to look at novel brain models, right? So we can look at normal DBS is where we put continuous electricity into the brain. We are now trialing to see whether we can measure the abnormal signal for the brain and only stimulate that part of the brain when the abnormal signal is there to try and improve those symptoms. So what I love about what we do is that the research that we do goes from the bed to the lab and back. And what we do in the operating theatre informs neuroscientists. What neuroscientists do in the laboratory inform what we do in the operating theatre. Of course, there are ethical aspects. Functional neurosurgery is never without risk, and we should only be operating on patients who have tried every other therapy that doesn't work and where their lives are really torn apart by their symptoms. There's no room for looking at surgery to enhance our brains. If you want to enhance your brain, go read a book. It's much more efficient, much less risky. Also, we've got to remember that medicine is a humane science. Compassion without the competence is useless. Feeling sorry for someone doesn't help. Competence without the compassion, it's just meaningless. So in summary, we are absolutely lucky to be here tonight. We are all sentient stardust. Stars have died so that you could be here today. Functional neurosurgery is absolutely a unique opportunity for us to ethically explore the functioning of the human brain, and I'm really privileged to do this in my day job. This curiosity, my voyage, has been one with a huge team of people who I love and adore in London. And also, it couldn't have been possible without the funding bodies that you see over there. And finally, it certainly could not have been possible without the patients who trust us with their lives and trust us to do research to understand more about what goes on in the brain when it's diseased and when it's healthy. Thank you.
Thank you.